Okay, so good evening class. Our lesson for this evening is about, to continue rather our lesson this evening about immune system. So we're going to talk about now the uh, type of immune system. No. So basically, our immune system we use this against pathogens, bacteria, virus, fungi, etc. Okay. So we have the first line of defense. Basically, we have the skin, which is considered as the first line of defense or our covering of the body. Okay, so it is the first line of defense against this pathogen, chemical, mechanical, and other forms of harmful substances that surrounds us. Then you have your second line of defense, which is your non-specific immune system, which includes your WBC, uh, NK cells. So we have also uh, inflammatory response, fever, okay, and phagocytosis, created by the phagocytes or macrophages. These are uh, non-specific immune response. Okay, and then you have your third line of defense, which is the specific immunity, which involve the humoral and cell-mediated immunity. Okay, so immune system. So we have uh, basic terminology, which we have to learn first. We have your cytokine. Cyte means cells. Kin means movement. So these are the moving cells. No? So these are known as messenger. Then we have the lipokine, which is when you say lipo with that live refers to lymph, which is a fluid. Then movement. No, this is our fluid that moves in our uh, immune system. Then you have your monokine, one, the movement. So interleukins, you have between, then leukin means white. So this is between the white blood cells. Okay. So we have here in our immune system, we have chemical messengers, which involves the cytokines. Okay. Then we have also messenger for the B cells and T cells. Okay. Then we have the monocytes and macrophages, which secretes this monoclin and interleukins. Okay. The the basic purpose or primary purpose of these substances are they send messages among leukocytes. Okay. Then, so when you talk of non-specific immunity, uh, when you say non-specific, it is our line of defense which targets not only the bacteria but as well as it could damage the uh, the good cells. So that's why it's called non-specific. So just like throwing a grenade in the midst of of the soldier, or throwing a grenade to a soldier which is in the middle of the market. So although the soldier may die, but at the same time there are a lot of collateral damage, which includes civilians, properties. So that is non-specific. No? Whereas when you say specific immunity, so it targets only the pathogens. So these are snipers. No? They act very specific, or they are the uh, silent killer. No, you get my book. So uh, these are very specific, which targets the the, the pathogens or disease-causing microorganism. So in that specific, you have your mechanical, physical, and chemical. So these are the pathogens, okay, that acts on the body. So, so they cause diseases in our body. No? So example of mechanical. So you have your or rather there are barriers rather. So example of mechanical barriers that protects us against pathogen. You have your sweat, your mucus, your cerumen. So these are barriers. No, so let's take for example cerumen. So they traps dust, microbes, which gets into your ears. You have also your mucus secretions. No, so they trap bacteria that moves into your nose or even to your mouth. No, so that's why you produce secretions coming from the goblet cells. Chemicals. So these are example of these are your tears, saliva. So these are chemical barriers. They have anti uh, white blood cells, which is found in those substances. No? Okay. So let's go now to uh, secondary defense. Then I have your phagocytosis, inflammations, pyrexia or fever. Okay, so pyrexia means fire or fever. Uh, Inflammation, that refers to the inflammatory response of the body. So it is still a non-specific. Okay. Phagocytosis, that is non-specific because when phagocytes engulf, it includes the good and the bad cells. Inflammation, so of course, this is a non-specific immunoresponse which targets the bacteria, but at the same time, it will also damage good cells, which is adjacent to the area damaged. Pyrexia, fever. So as we all know, fever is in non-specific immune response to the body. Okay, so anything that is exposed to heat will die, but at the same time, your normal body cells will also damage. Okay, so one example of that, if you are experiencing, so let's say, not only fever, but experiencing uh, convulsions, no? So usually you suffer convulsion if your body temperature will increase beyond 40 degrees Celsius or 40. So that increase of body temperature will kill the bacteria that causes your body temperature to increase, but at the same time will also damage your nervous system. That's why you suffer from convulsion because your nerve or your neurons fire electrical signals abnormally. So specific immunity, we have two types, humoral and cell mediated. Okay. So again, when we talk of specific immunity, it may be acquired or it might be passive. So when you say acquired, that is maybe acquired to your mother or maybe given to you by uh, so no. So there are some specific immunity that could be inherited. No? Uh, so when you say acquired, you have your vaccination. That's an example of acquired. Also, sometimes exposure to to pathogens. That is an example of acquired. So when you say inherited, so specific race have sometimes specific immunity to certain diseases or pathogens. So cell mediated. Cell mediated. So as I've said before, the bodies are the response of the body or specific response of the body when the bacteria is already within the cell. But when it is outside, then the body will use the humoral immunity or the fluid, no, which is basically antibody mediated. So we have here two types of acquired immunity. We have active and passive. So when you say active, uh, could be form of natural and artificial. So natural immunity, that is basically you subject yourself to or you expose yourself to bacteria or to viruses, so such as herd immunity. You have heard of that, which is very common in this pandemic. No? So in herd immunity, individuals is subject for exposures to the viruses or bacteria so that they could be immune. Then artificial, Malaysia vaccination. So that's why kanang vaccine karon sa COVID-19. That's an example of artificial immunity. When you say passive or passive acquired immunity, so there are two types. You have your natural and artificial. So natural, that is transferred from mama to baby. That is natural. Artificial, these are immunoglobulin has harvested from a donor who develop a resistance. Let's take for example kanang uh, anti-venom in development of anti-venom, no? So kanang individual nga napaakan sa alas siya o namantay. So usually nanan say artificial immunoglobulin which is found sa iyang blood. So makatabang na siya, no? Extract siya ng immunoglobulins can produce, then it could be administered to other people. Okay, so these exercises, three, and I'm going to give this as an your activity that will be submitted before the end of the final. So these are the basic terms that you could see, when we talk of blood. So you have here appendix, appendicle, vaso or base, of blood, hemo, bone marrow, myelo. Take note na different na siya sa Miyengosel, no? Clotting, thrombo, clotting, agglutinin, disease, patho, it, swallow, phago, fever, fibro. So these are the basic terms and these are the meaning, no? Or combining form, no? Ano yung meaning sa combining form niya. So morpho, shapes, serum means serum, thymos, and then you have your prefixes. When you say without, anti means against, enter means between, mono means one, poly means many, two before. So we have also suffixes. Okay, so these are the suffixes. No? So when you say erythropoiesis, that is erythro, red. Cool. So, nana. So these are the diseases. No? So we have here an example of a, a medical letter which written in uh, using medical terminology. So actually, this is a medical certificate, addressed to uh, the teacher. So here, the letter says, "Dear Dr. Queen." Okay, so uh, this letter is for Dr. Queen, a school doctor or a school physician. Uh, then it is written by Dr. Allen B. Corwin. Okay, so a physician in the city. Okay, might be where the students have this medical checkup. So it says, please find the enclosed summary of treatment for Manny Ochoa, date of birth, 1889 or 1989 rather, a college student whom I treated in my office last month. He requested that I forward this to you as his primary care physician in his hometown. I understand he will be returning home this summer. This 21-year-old college student had a 2-week history of sore throat, stiffness, and tenderness of his neck. Notice sore throat, stiffness, and tenderness of his neck, and extreme fatigue. On examination, he was mildly pyrexic with posterior cervical lymphadenopathy, palatal petechia, and pharyngeal inflammation without an exudate. So, cervical lymphadenopathy. So, cervical means sa neck, no? So, ay ihang lymph dira hubag, no? Palatal petechia means ay mga pula-pula dito sa ihang palate. Okay, then pharyngeal inflammation. So, kabalo naman tayo na. Ano na siya? Abdominal examination showed marked splenomegaly. So, that is the term that we need to take note of. There is an evidence of skin rash or jaundice. Uh, Jaundice, this is a color. Kabalo ito sa color, anak. The clinical diagnosis of infectious mononucleosis was confirmed on investigation. So, infectious mononucleosis. More than 50% of the lymphocytes showing a typical lymphocytosis. His serum contained IgM antibodies to the Epstein-Barr viral antigen. Liver function test results were normal. He was treated symptomatically and was advised to avoid strenuous activity until his splenomegaly has completely resolved because of the danger of splenic rupture. He was also advised to abstain from alcohol for at least 6 months because many patients showed clinical biomechanical chemical evidence of liver involvement. Sincerely yours, Allen B. Carvin, MD. So if you asked, how do you know that the patient had a slight fever? Of course, here from the term mildly pyrexic, diba? Pyre means fire, so init siya. On examination, what phrase might explain why his throat was sore? So basically, yeah, I don't know, sore throat. So naa siya no, yeah, kung anong sore ang iyang throat. Na makita na to, palatal petechia and pharyngeal inflammation without eczema. Diba? Pharyngeal throat inflammation. The code, cervical lymphadenopathy. So, may cervical lymphadenopathy. Cervical means neck, lympha, this refers to your lymph nodes in your neck. So, no, the how do you know that the patient's spleen was enlarged? Okay, na naman. Kani mark splenomegaly. Megaly means enlargement of the spleen. What term tells the test's result showed increase in number of lymphocytes? Ano ito siya? Atypical lymphocytosis. Okay? So, ano siya? Then you have your abbreviations. BMT, bone marrow BUN, blood urea nitrogen, biopsy, CBC. So these are abbreviations. This could be seen also in notes. No? So it is very important for you to note these abbreviations and their meaning. So you have NK, natural killer cells, NA, sodium, mutes, neutrophils, PCV, part cell volume hematocrit, PTT, partial thromboplastin time, RBC, there's systemic immune response syndrome, stub, bad cells. So ano siya, sa atin ng tigamnan kay mag-encounter nato na sila sa mga notes, no? Nga nga nabasa nato. So another one. Okay, so we have here sickle cell, partial sickle cell surgical procedure na history, present illness. So these are example of notes na makita nato sa nurse stations, no? Of course, dito sa gawas, anak naman na siya computerized, pero dito sa Pilipinas, napa man na siya na paper. Okay, so you have here a patient history present illness on the above. The patient was admitted via the pregnancy room with chief complaint of pain all over his body since the night before. The patient's a 42-year-old African American male with history of sickle cell anemia stated that he started having pain all over his body, specifically or especially at the back of the legs. He also notes having chills but denies sweats. Medical history: the patient has a medical history of sickle cell anemia and pneumonia in 2004. Surgical history: surgical includes a total hip replacement and appendectomy. Allergies: the patient has no allergy. Medications: naka Motrin and Darvon. Occupations, the patient is unemployed or disability. The patient is a non-smoker and non-drinker. Family history, mother and father reveal sickle cell trait. Ay dumahe sa remarkable. So, yung father o mother na ay carrier sila kay sickle cell trait laman. Dili man sila nag-manifest sa sickle cell. Physical examination, temperature was 98.1 degrees, that is Fahrenheit. Okay, so slightly, no, na sila sa, yes, slightly elevated lang. Blood pressure was 155 over 90, so systolic hypertensive. Heart rate 75, respiratory 23, normal. Consultations. The consultation included Dr. Smith for sickle cell disease, pertinent laboratory studies. So, yan na ang mga lab results niya. Stable. So, question, what statement is in the discharge summary indicates that the patient was in sickle cell crisis? So, okay, tanong na ito, ano? Eh, tanong ito ang number sa iyang uh, WBC. Kana ta elevated sa 12.9. Aside, ano eh, global body pain. Okay. Okay. Analgesic ka na. Okay. Did Mr. Samuelson parents have sickle cell anemia? How do you know? So, wala lang, but they are carrier. No? Sickle cell trait. Patient past healthcare history mentions a resection of his. Some past medical resection, hip replacement, and appendectomy. So, nasa hip replacement and appendectomy, resection. So, appendix. Inana na siya magtanaw sa chart, no? Magbasa, i-interpret. So, yun yung tanaw ron, no? So, these are the basic word, mga word part definitions in word shop. Inana. Okay? And we will go with the circulatory. The terms related to pathology. No? Pathology, so these are diseases, which is very common in involves blood. So you have the B12 deficiency anemia. We have also folate deficiency anemia, pernicious, sideropenia, uh, autoimmune acquired hemolytic anemia, glucose 6 phosphate dehydrogenase. It's an inherited anemia or hemolytic anemia, hemoglobinopathy. So hemo means blood, globin protein, pati disease, so disease of hemoglobin, hemolytic. So these are basically term, no? Na nakita na to sa blood and immunity. So, so you have also here, okay, so exercise 4, again, I'm going to make that as moment activity in intro to PT. So, as well as your exercise 5. So you have 3, 4, and 5. Okay. Okay, so that's all for blood. So, so you have your assignment for this activity. You have and 5 activity. Okay, thank you for listening. So